Sathyabama Institute of Science and Technology.
Hello everyone, I am Dr.S.Aishwarya from Department of Pharmacy, Sathyabama Institute of Science and Technology. Today we will discuss a topic on type 2 diabetes mellitus. We will discuss like a case history. Coming to the case scenario, here we are having a male patient of 45 years old present with the complaints of polyuria, polydipsia, polyphagia and weight loss and easy fatigability. Nothing but the patient is having increased frequentations of urinations and increased food cravings and increased thirst. By this we can slightly understand that the patient is having some symptoms of type 2 diabetes mellitus. And coming to the other symptoms, the patient is having plasma glucose level of 335 and his HbA1c is 10.2% and this is slightly increased from the normal level. And he is eating a junk foods outside with his colleagues and he is also having complaints of decreased vision for which he is consulted an ophthalmologist. Now, these are the questions we are going to discuss about in this case scenario. The first question is, what is your diagnosis? The patient is already having is fasting plasma glucose level more than 335. That is, it is increased than the normal level 126. So, by this you can confirm for 30% the patient is having diabetes mellitus. And one more test is, and the patient BMI is 32. We can check the patient is having class 2 obesity and this is very high and the patient may have high risk of any heart and heart issue problems also. And by this we can confirm that the patient is having type 2 diabetes mellitus, and one more confirmatory test is there for the patient. Nothing but the patient is having the physical signs of acanthosis nigricans. Nothing but the patient will have dark black patches under his arms and at the behind the neck also. And coming for the confirmatory test, the first thing you have to do is you have to check the patient fasting plasma sugar and oral glucose tolerance test. And how to check the fasting plasma glucose? You are supposed to make the patient to be in fasting for minimum 8 hours. Usually type 2 diabetes mellitus test will be taken in the early morning in the fasting level. So, you are supposed to prick the blood for the patients in the fasting in early morning without drinking a little amount of water. And by that you can check whether the patient is having 126 above or not, the blood glucose level. If it is above, you can slightly confirm that the patient is having type 2 diabetes mellitus. And coming to the oral glucose tolerance test, what you are supposed to do is you have to take 75 grams of oral glucose and mix in 250 to 300 ml of water and ask the patient to drink that water for 5 minutes. And after 2 hours you are supposed to check the blood glucose level. If it is above 200 milligram per deciliter, you can confirm for 100% the patient is having type 2 diabetes mellitus. And coming to the prevention, they are having 4 types of preventions. First is pre-primordial, second is primary, secondary and tertiary. Can you prevent the patient in pre-primordial? It is failed because the patient father is having diabetes. You are failed in the pre-primordial prevention. And coming to the primary level, you are supposed to check whether the patient is having other risk factors. Here the patient is having obesity, dietary habits, mostly of junk food intake. So, you are failed in primary level of prevention also. And coming to the secondary prevention, the patient is already have failed, he is above 40 years. So, undergone with many FBS and postprandial blood glucose level check annually. So, he is having almost all the risk factors. You have failed in the secondary prevention also. And coming to the tertiary level, this is the last level where you can save the patient. Nothing but you can prevent the patient from not improving the other symptoms like cardiovascular events or any nephropathy or retinopathy and etc. You can prevent the patient in tertiary level like disability limitations and rehabilitation. And before going into the treatment part, first we will understand what are the other complications that the diabetes will cause. First thing is microvascular disease. It will be of 3 types. The first one will be diabetic retinopathy, diabetic nephropathy, where the patient will have chronic kidney disorders, and diabetic neuropathy, it may cause silent myocardial infarction. And coming to the diabetic retinopathy, this patient is already having some symptoms of eye problems. So what you are supposed to tell is, the patient should go for eye checkup for every 6 months. Before retinopathy symptoms, you can tell the patients simply like go for eye checkup for every year once. And coming to the second, macrovascular disease like coronary artery disease like myocardial infarction and peripheral vascular disease like stroke. So these are the complications where a patient can get if the patient is not treating the diabetes properly. And coming to the clinical pharmacist part, where the PharmD people, those who are studying PharmD, B Pharmacy, Pharmacy Practice, and Diploma in Pharmacy, those who are studying pharmacotherapeutics, here they play a major role in the as an hospital clinical pharmacist. So after the diagnosis of a doctor, what the clinical pharmacist is supposed to do is the patient should know what kind of disease is he having. The clinical pharmacist should explain the complete disease, that the diabetes is a disease, it cannot be cured but it can be prevented in many ways. So first thing you are going to tell is his dietary modifications. The patient should eat more green leafy vegetables, spinach, fenugreek and cabbage, cauliflower, cucumber, gourds and etc. And coming to his diet part, he should completely avoid the junk foods and etc. And since the patient is just 40 years, you can tell the patients to do some aerobic exercise also to make him very active and to improve his quality of life. And he should have a balanced diet. Instead of eating rice, he can take some roti and ragi balls. And coming to the pharmacology management. So this is a major part of a clinical pharmacist where play a major role. Like here the patient was given with 3 classifications of medicines. The first one is biguanides. In that the patient was given with metformin. If the patient is having nephropathic types of problems like chronic kidney disorders, the patient was not given with the metformin. Here in this patient you can give the metformin. So why it is given, like to overcome the insulin resistance. And coming to the DPP4 inhibitors like linagliptin, vidagliptin types of drugs can be given. So here the patient was given with linagliptin. And coming to the sulfonylureas, the patient was given with glipizide and tolbutamide in order to enhance the insulin secretions. So here we can completely come to know what kind of disease this patient is having and how to diagnose and how to prevent the patient, and other pharmacological and non-pharmacological management is being discussed here. And coming to the next topic. So all the medical people, all the pharmacotherapeutics, those who are reading pharmacology, etc., should know these things. So it is like a mnemonics where you can remember all the diabetic drugs, that is oral hypoglycemic drugs, in easiest way. So this is the way I just follow for my students. So what you can see is the first line, Subi make the alpha DPP. How you can remember? Subi is a girl, she should make the alpha DPP. So Subi make the alpha DPP. Coming to SU, sulfonylureas, where you have 2 generations of drugs. First generation will have amides in their suffix. So you can easily remember tolbutamide, chlorpropamide. And coming to the second generation, the drugs will be end with the suffix of ide, glimepiride, glipizide and gliclazide. So you can easily remember with these suffix. And coming to the biguanides, which will end with the suffix of formin in the drugs, metformin, phenoformin. And coming to the meglitinides, will end with glinides, repaglinide, natiglinide. And coming to the thiazolidine, diones. So it will end with the sound of ones. Rosiglitazone, pioglitazone will end the suffix with on sound. And coming to the alpha glucosidase inhibitors, with the sound of ors in the suffix, you can write the drugs like agrobose, voglibose will end with the sound of os. And coming to the DPP4 inhibitors, you will have 2 types of drugs, sitagliptin, vidagliptin and linagliptin. So it will end with the suffix of gliptin in their suffix. And coming to other miscellaneous drugs, SGLT2 inhibitors, where you have only 2 drugs, dapagliflozin and canagliflozin, which will end with the suffix of gliflozin in their suffix. So this is the easiest way you can remember the oral hypoglycemic drugs. And next we will check about the mechanism of action in a simple manner. Just a single word is enough to remember all the oral hypoglycemic drugs. Coming to the enhanced insulin secretion, the three major classifications will play these roles: sulfonylureas, meglitinides, and DPP4 inhibitors. In that, sulfonylureas and meglitinides will do the potassium channel blockers so that the sodium will be get released in the urine. So the patient hypertension level or other diabetic values will get decreased. And coming to overcome the insulin resistance, two classifications of drugs are there, nothing but biguanides and thiazolidinones. And coming to the retard carbohydrates absorption, a single classification of drug, alpha glucosidase inhibitors. So this is the manner you can easily remember the mechanism of action of oral hypoglycemic drugs. Thank you.